Yesterday, the NHS Confederation warned of a brutal Easter and called for the return of masks and limits on indoor mixing.
So is it going to be another holiday potentially hampered by coronavirus? Let's speak to Dr. Tony Hinton this morning. A very good morning. Look, it may very well be that this weekend you've got an Easter Sunday lunch planned with maybe the grandparents, the grandkids as well, 3 generations around the table, sharing chocolate, maybe a nice, joint of lamb. Should we be worried about everyone test before you arrive, someone wear a mask? Should there be any sort of coronavirus restriction on our weekend?
Good morning, Rosie. I think the first thing I'd say is that before 2 years ago, would any of us have done any of those things? And when we look now at Omicron, which has 3 versions, a BA1, a 2 and an XE, which is combined, still the infection fatality rate is much lower than influenza. So we should treat it in the same way. If we look specifically at the masks, there is only one good controlled study of masks from Denmark from over 18 months ago now. And in that study, 3,000 people didn't wear masks. 3,000 people were actually taught how to put masks on and off properly and wear them properly. And they were given a fresh set of medical grade masks each day and told to change them every 4 hours, which is what none of us do anyway. And in that study, the masks made absolutely no difference. This doesn't spread through people breathing through the mask. On a cloth mask, the perforations are about 5,000 times larger than the virus. On a medical mask, the perforations are about 1,000 times larger than the virus. So it's completely illogical to think a mask will stop spread of COVID. It spreads by aerosols just in the air. But it is now such a mild disease, we have to treat it as such. And I think the government is quite right that we have to learn to live with it. So people should enjoy their Easter.
Doctor, why do we think then that there is this concern being raised about what might happen over Easter with lots of people getting together? I mean, clearly, it seems inevitable that it will see a bump in the numbers, a bump in the infections. But if that's nothing to really worry about at the moment, why is it causing so much concern?
I think some people have got into a mindset that they are just continually concerned about this. Let's just have a look at what's happening in China. They're still supposedly going for their zero COVID policy. And you look at the terrible things that are happening in Shanghai. 26 million people locked into their apartments for over 2 weeks now, running out of food and water. Their children being taken away from them if they test positive, and their pets, dogs and cats, being killed in case their pets spread COVID. Is that what we want to see in the UK? I would prefer to live with this virus. There are at least 4 other coronaviruses that regularly come round each autumn and winter and are one of the things that give us the common cold. And this is also a coronavirus, this COVID, this Omicron, and that will be a 5th. And it will come round at certain times. It will affect people less and less as more and more people get immune, and it will gradually just become like a common cold.
Well,
we have to learn to live with it.
Well, let's hope that happens sooner rather than later, because then we can just get on with lives properly. Dr. Tony Hinton, good to talk to you this morning. Thank you.
Pleasure.